when I arrived at NHS London, there was already a very clear vision developed for the future of the health service in London. And that vision for the health service in London was to transform it into a health service fit for the 21st century. We also had a strategy. So we had a strategy then to implement that vision that was in that document. But as we all know, strategies are worthless without effective implementation. And healthcare, at least in this country, presents some very unique challenges to implementation. And I'm sure many of you know that. And that is why, over many, many years, indeed decades, so many strategies that have been written, and particularly about London, changing the healthcare in London, bringing it into the right century, have ended up gathering dust on a shelf somewhere. So the first task in NHS London was to change the board. Because if you don't have a board, as I said to you before, that's full of people that know what they're doing, they've got expertise, they have a global vision, they're international people, then you'll never get anywhere. That was very important because that brought me straight up against the Appointments Commission. That is bureaucracy gone mad. I mean, I'd never come across anything like this in my life. And so, you know, it took an enormous amount of effort and frustration and time to sort this out, because this was a £14 billion business. A £14 billion business would put NHS London in the top 30 of the FTSE 100 companies. And yet, the first question that was asked of people who were wanting to be appointed to the board was, how much charitable work have you done? My response to that is, it's a £14 billion business, it's not a charity. You've got to run it like a business. The good thing was there was already a good executive team in place. And that was good because the executives were good. Ruth Carnell, who was the chief executive, was brilliant. And so she in herself, in my opinion, was a fantastic leader of people. Then the second hurdle, of course, was change itself. And it remains, for me, something of a mystery. Nevertheless, why a configuration of primary care and hospital services so firmly rooted in the last half of the last century should be subject to such passionate defence whenever every other service industry in the world has changed beyond all recognition. That has got to have something to do with leadership. But how times have changed over the last 50 years. We now have clinical practices supported by technologies that were little more than science fiction if you go back to the 60s. And that, of course, enables us to provide much more healthcare locally and safely than the district general hospital model allows us to do. We had 31 PCTs. Well, you know, that's madness. So if you've got 14 billion, each one of these had a turnover of 350 million, 400 million a year. So you have to have 31 chairmen, 31 chief executives, 31 times 6 board members. I mean, it drained the intellectual property of London. So you cannot have it, it doesn't work. So that's one thing. Then you've got 32 councils who don't work with the PCTs. In fact, they fight each other all the time. So there's no relationship between that lot at all. The mayor, of course, just wants to be awkward and says one thing on one day and says something else on another day. Local MPs are just politicians and they do what they think they ought to do. By encouragement, by discussion, by communication, by talking to these people who are all sensible, we agreed that we would have 6 PCTs and they'd all work together to form those 6. So that was brilliant, because now what have you got? You've got a PCT that's got some critical mass. It's got 2.5 billion to spend. When it goes knocking on the doors of one of these big academic health science centres, it says, I've got 2.5 billion. If you don't play the game, I'll go somewhere else. There are forces out there that you cannot deal with. So this programme, Healthcare for London, a strategy for action, as I said before, had gone out to consultation. I mean, people who work in the NHS know that you don't do things without going out and getting agreement, getting approval, otherwise it'll come back to bite you. So you can see here that people were communicated with, and this was led by clinicians. It was led by clinicians, it was agreed by clinicians, it was agreed by people, and yet, when the government changed, they stopped it. And we had looked at this from a financial perspective because we knew that the financial situation had changed even before the election, if you remember, and we had to do a financial analysis of all this stuff we were doing to find out whether it was still affordable. And that analysis, which was done with McKinsey, showed very clearly that not only was it affordable, but you could not afford not to do it, because the alternative was not affordable. Never trust politicians. I mean, I saw Andrew Lansley. I'm not a raving socialist, to be honest with you. I saw Andrew Lansley on a number of occasions. I told him what we were doing. I explained to him what we were doing. Fine. No big changes. We ain't going to change anything significantly. So, you know, that's a problem, and you can't avoid that. I mean, you can have the strongest leadership, the strongest management. That will kill you. The organisation is risk-averse, and that's always a terrifying thing when people become risk-averse, because then they never do anything. And obviously, you're not going to do anything stupid, but sometimes you have to take risks. No decision can be made without taking risk. And so, if everything's risk-averse and you're frightened of doing something, there's no leadership there. That just lacks leadership completely. One of the pleasing things for me, working in the Strategic Health Authority and working with the people in the PCTs, I just met some really, really nice people and some very good people and very well-intentioned people, but not enough leaders because either they just knocked out of them or they just didn't have the space to operate. I think the future could be very, very bright. We've got tons of infrastructure, we've got the best medical charities in the world, pump lots of money into medical research, got very good research facilities, but at the centre of all this is the test bed, is the NHS. And if that isn't working, if the central cog isn't working, the rest of it is to nothing. So my point to you is that the NHS is critically important to the economy of this country. And if it doesn't change the way it operates, if it can't stop this bureaucracy, this regulatory framework that strangles it on a daily basis, I think it's a bad thing.